Good evening and welcome everyone to RestartED's virtual town hall. This is our fourth webinar in a series of panel discussions with educators and professionals devoted to rethinking, reimagining, and restarting our schools. My name is Dave Adderhold. I'm a school superintendent in New Jersey and the president of the Garden State Coalition of Schools. I'm honored to moderate tonight's discussion. And I want to send my thanks and appreciate to the Restart team, Ed, for the invitation to join tonight. Thank you once again to everyone who's joining, and to welcome back for those of you that have been here before. RestartED is a dedicated group of New Jersey-based educators. Their focus is on reopening schools amid the coronavirus pandemic and modernizing education through dialogue and action. Their goal is to improve the collective capacity of educators to serve students, staff, and communities. The focus of tonight's panel discussion is on medical guidance for schools reopening as state departments of education, state departments of health, and school districts across the country work to safely reopen our schools. Tonight's panelists are Dr. Wagner Marseille, school superintendent for Cheltenham School District in Cheltenham, Pennsylvania. Wagner earned a bachelor's degree in finance from Fairleigh Dickinson University. He then went on to obtain a master's degree in educational leadership from Rider University, and then to University of Pennsylvania, where he earned a doctorate in educational and organizational leadership. He's been a classroom teacher, an assistant principal, director of secondary education, assistant superintendent, acting superintendent, and superintendent of schools. He's also a 1996 Olympian from Haiti. So Dr. Marseille, welcome. Next, we have Allison Budenheim. Dr. Allison Budenheim also holds a master's in business administration. Her PhD is in public health. She is the associate professor of nursing and health policy from the University of Pennsylvania School of Nursing. She's also the co-founder of Dear Pandemic. Dr. Budenheim is a social scientist and public health researcher who studies the behavioral aspects of infectious disease prevention. Her research applies the tools and frameworks of behavioral economics to persistent public health challenges, including vaccine acceptance and HIV prevention. In March 2020, she co-founded Dear Pandemic, a social media initiative to bring good information on COVID-19 to people who need it. Welcome, Dr. Budenheim. Denise Dietz, PhD and Masters of Public Health, is the Associate Director of Epidemiology for Bristol-Myers Squibb. Denise is an epidemiologist with over 6 years of pharmaceutical experience in epidemiology, and with work directly in products and clinical trial development, as well as the post-market drug arena. Prior to her time in pharma, Denise served as an epidemiologist at both the state and local health departments within New Jersey and communicable disease services. In that capacity, Denise worked in reportable disease surveillance, outbreak investigation, and as a liaison between health departments and community partners. She completed the CDC Fellowship, Emerging Infectious Diseases, in 2002, and has volunteered at a call center and saliva testing site during the 2020 COVID-19 response. Denise, thank you and welcome. Julie Scotto is an associate director epidemiologist, also at Bristol-Myers Squibb. Julie works on performing benefit risk assessment and risk management strategy in immuno-oncology therapies. Julie earned a master's in public health and epidemiology from UMDMJ and has a bachelor's in chemistry from SUNY Albany. She holds 20 years of research experience in corporate, hospital, and academic settings. In addition to studying the pandemic from an epidemiological standpoint, Julie has a vested interest sharing information regarding reopening of schools as a mother of 2 young boys in New Jersey Public Schools. Julie, thank you and welcome. Thank you. And Robin Kogan. Robin is a nationally certified school nurse, currently entering her 20th year as New Jersey school nurse in Camden City School District. Robin is the legislative co-chair to the New Jersey School Nurses Association. She's proud to be a Johnson & Johnson School Health Leadership Fellow and Program Mentor. Her awards include the 2019 National Association for School Nurses President's Award, the 2018 National Certified School Nurses School Nurse of the Year, the 2017 Johnson & Johnson School Nurse of the Year, and the New Jersey Department of Health 2017 Population Health Hero Award. Thank you to all of our panelists and welcome Robin in joining us tonight. It's an impressive panel to say the least, and their combined experience will help place light on a lot of questions that we have as a state and as a nation regarding reentry and reopening our schools. As we begin, I'd like to invite our audience to join us in cyberspace in the chat room, to actively participate in the chat, and to assist us in facilitating the ongoing dialogue in the chat room and on Twitter. Tonight there are several Members joining the RestartED team, we have Jay Micah, Superintendent of Matawan Aberdeen Regional School District, Dr. Scott Rocco, President of the New Jersey Association of School Administrators and Superintendent of the Hamilton Township School District, Dr. Mike Salvatore, Superintendent of the Long Branch Public School Systems and the 2019 New Jersey Superintendent of the Year, and Dr. Charles Sampson, Superintendent of the Freehold Regional High School District and President of the Monmouth County Regional School, Superintendent's Roundtable, excuse me. They'll be monitoring your questions and providing feedback in real time. And throughout this town hall, the panel welcomes your questions and encourages you to share ideas as we create a collaborative atmosphere designed to strengthen education. So to frame the conversation tonight and to sort of kick us off and get us started, I thought I'd start with two quotes from the past several days. The first quote comes from this weekend. Dr. Michael Osterholm, the director of the Center of Infectious Disease Research and Policy at the University of Minnesota, stated, "I don't think this is going to slow down. Whenever there is wood to burn, the fire is going to burn. COVID-19 will rage like a forest fire in a U.S. that has no clear plan to deal with it and has regressed to a diminished pre-pandemic attitude." Right, so that's our first one. And as we forward, just this past Wednesday, Dr. Ashish Jha, from the director of Harvard Global Health Institute, stated, "We may be done with the pandemic, but the pandemic is not done with us. We know how to wrap our arms around it, but if we choose not to act, our future looks pretty tough." And on that note, and with the additional context that the United States broke our own national record on 2 consecutive days with the highest number of new COVID cases in a single day, let's commence today's town hall with our panelists. So Wagner and Robin, as school officials that are charged with building reopening plans and weighing in on a multitude of contingencies, why don't we get started with you? Just some thoughts about how you're approaching reopening, and sort of what are those things that keep you up at night with respect to the pandemic?
Well, I'll start. Everything keeps me up at night. Safety, security keeps me up at night. I'm very concerned about the decisions that are being made. We have very little guidance from the federal level to the state level to the local level. I feel like, we're looking at every plan across this country that's already been released. They're all somewhat similar. And I think we're all feeling the same way. Are we safe to return to school? And how can we be sure that our staff and our children are safe?
Thank you. I share the same sentiments. But the reality is that this country is in hyper acceleration mode to reopen. And under a number of factors, they want to get the economy started. And I think that that's a one-sided perspective that puts school systems in a very difficult, challenging position. And I am not a medical doctor, but I am asked to provide this high-level medical attention to thousands of students with cases surging, even though in Pennsylvania, Governor Wolf is moving Pennsylvania from the 3 colored, from red to yellow to green, no different except for opening up new businesses. In-person instruction can take place. No more than 250 individuals congregate in one area. The challenge we have is conflicting statements with regards to how safe it is to return. So schools are interpreting the CDC's guidelines as just that. There are guidelines, they're not mandates. We're going to try very hard to do what we can. And it's difficult to send children and adults to school knowing the risk. But we're being told that America needs to learn to live with COVID-19, and that we're just going to have to figure out ways to manage it as opposed to run and hide, which in a public school setting is unconscionable, but nonetheless, we are tasked to come up with a plan following CDC guidelines to open schools as safely as we possibly can.
And Wagner, just to follow on that, is Pennsylvania still waiting for your guidance to be officially released?
Actually, PDE, as of yesterday, released a 64-page document providing guidance to school systems. I don't think it's any different from any other guidance I've seen from Kentucky, California, Maryland. It does provide parameters with suggestions, but it doesn't give you a clear, this is what you're going to do. So it's up to the school district to determine. What they want to be clear, though, is we want you to open, and we want you to open in a physical manner as much as possible. So when you do, we recommend that you maintain social distancing. We recommend that you think about that staff wear masks. We recommend that you think about which students should wear masks, when they should wear it, how they should wear it, but it doesn't really give you enough meat to feel confident moving forward. And superintendents are interpreting that across Montgomery County oftentimes differently.
Wagner, why don't we move and jump get some of our epidemiologists and public health officials into this? So what do we do? No. So from your perspective, you know, where are the challenges, and you know, what would your lens be on how we should be approaching reentry?
So I have some things to share, I guess. Basically, from my standpoint as an epidemiologist and also a parent, some of my concerns is that, you know, we don't know what the fall is going to bring, but we do need to plan as though it may be a full reentry, it may be partial, and it may be a hybrid, or it may be not at all. It really does depend on what's happening at the time that, you know, fall approaches us. You know, because we're seeing an increase now, as you started with your quote in the beginning, you know, we know now it's most likely not seasonal. It's most likely going to be this forest fire, where we probably see peaks and valleys. And, you know, if that's the case, you know, where's our state going to be at the time that the fall arrives? And we need to be ready for potential changes after that time, even if we do have a fall. We really need a plan that's very granular, that thinks through all the potential scenarios that we're all concerned about, so that we feel comfortable with opening at that time. You know, hopefully there will be a communication path for both up and down to get our answers, to get our questions answered, and then, you know, we can hopefully, you know, make everybody feel good at the, you know, at the parent and child level. Because there are going to be a lot of requirements, and, you know, some things that come to mind. You know, I know we talked a lot about masks. I've been thinking also a lot about just the airflow in general. Can you hear me okay? There's also just the resources. You know, are there going to be disparities across the different schools? You know, how do we accommodate for the differences across the different schools in a way that's fair and safe and equitable for everyone? And then just the uncertainty of the risk, because there are things we don't know still. There's a lot we do know. You know, it's been 6 months. There's a lot we know about, you know, children having a lower incidence. You know, we know it's less severe, but there are cases where it is more severe, and we know that if possible the transmission is less, but we don't know that with certainty. So there's a lot of unknowns, and hopefully we'll get more answers before then.
And Allison, from the perspective of the University of Pennsylvania and the School of Nursing and the work you're doing with Dear Pandemic, what are some of the thoughts you have regarding school reentry?
I mean, I went through the Pennsylvania Department of Education guidance a couple of weeks ago when they put out their template for the plan, the health and safety plan that each public school is required to do. And like Wagner said, I think there are 16 sections and 81 considerations, not specific guidance, but something you have to think about. And my worry is, you know, the clock is ticking, and what I want for us to be able to tell school districts and independent and parochial schools is what's really important and what's maybe a secondary, a secondary issue or a second order importance. Schools are thinking about everything from, you know, does the traffic flow have to go through, you know, one way through the school? What happens at lunch? The HVAC system, all the considerations for both educationally and medically vulnerable kids. How do we think about staff? And I don't see how we equip schools to be ready for this without some prioritizing. Like, if you can focus on 5 things in July, focus on these 5, and then in August, focus on these 10, and then we'll help you during the year to deal with the other 61 things on the list.
Thank you. Denise, I want to provide an opportunity before we go forward for you to provide some thoughts on reopening strategies or reopening concerns.
Yeah, so I'm going to echo what the previous panelist said, but I do think one of the major challenges is the timing. It's, we're almost in July and we have a lot of moving pieces and a lot of considerations and not a lot of time. So we have to prioritize full opening, partial opening. What happens if how many cases trigger virtual learning? There's so many moving pieces and not a lot of time. So I do agree that there might need to be a triage or a prioritization of how we move through this process.
So maybe we can take a couple of the key recommendations one at a time. Masks. Where's the panel stand on to be required or not to be required? And what do you do with specific populations, whether it's medically fragile, sensitivities, age of children, or staff members with potentially, or students with breathing difficulties and whatnot? Where do you draw the line? I think a lot of districts are wrestling with a lot of the what ifs and what do you do?
This is going to sound like a dodge, but when I think about the most important factors to try to put in place, to me, the cohorting or the podding or whatever you want to call it, the small stable groups that we can put kids in, the better we can do that, especially in the lower grades, the less important the masking question becomes. Not that it's unimportant, you still have to figure it out, but if you can get one teacher and, always reluctant to put a number here, but let's say 12 kids who aren't mixing a whole lot with the rest of the student body, it's less important that they're 6 feet apart all day and that everyone's got a mask on the whole time. So I like to lead the mask question with, if you can solve the cohorting, you've got a little bit more leeway on solving the masking problem.
There was one of the best things I saw was actually out of CHOP's policy lab, a really fantastic guidance about some very specific safety features in school. And one of them was exactly, that whole issue of, can we have a bubble of kids and staff and that aren't cross-contaminating each other? What would that look like? And then perhaps the teacher could wear a face shield and not a mask, because that would be so much better for emotionally and physically for the kids if they could see the expression on their teacher's face. And but yet when you look at a whole building, it's not one classroom. Or you look at a whole district like Wagner, this is a huge issue. I'm a preschool nurse, so you're talking about taking 15 kids, only really allowing space for 10. How do you choose which 10? Whose families get serviced? So, I mean, there's social issues, there's emotional issues, there's safety and physical issues, until we have a vaccine at this moment. Anyway, I would love some comment on the face shield though. Very curious about that.
We could just follow on the podding piece. I saw a comment in the chat that wants a little bit better understanding, because that concept's coming up more and more, of the idea of podding or bubbling or cohorting groups of students. It actually also shows up in the National Federation for High School Sports guidelines in phase 1 regarding keeping athletes in cohorts of 5 to 10. And my understanding of it, it's about limiting transmission circles, so that if you do have some form of outbreak, you might be able to track it right down to a specific group. It limits contact tracing concerns potentially. It does have lots of questions about movement in hallways, movement to restrooms in schools, transportation to and from, what, if anything, happens with respect to before or after school care. But I think the general concept of cohorting is, if you get 10 to 12 kids in a space, you bring them back together. They're always with the same adult. The adult theoretically then is not mixing with the other adults.
Right.
You can try to limit, and so the question becomes, is that really realistic when we start thinking about how facilities actually work and schools actually function?
It also makes, if you think about it, if there is a case, your contact tracing within the institution is basically done for you, because that kid or that adult who ends up as a case has ideally only been with that small group. So you eliminate sort of super spreader events within one building, and you eliminate the need to send everybody home if there's one case.
Yeah, no, I would agree with that. I think that cohorting is definitely high up there because, the reasons that were mentioned. It's definitely a way to reduce the spread. And, I think the masks, though, I do still see as potentially being useful, or a shield if you can't wear a mask. Maybe there could be some kind of a thought for that. I've seen those differences across the state with potentially allowing no masks or mandating the masks. I'm more inclined to use the masks, but I know that there isn't complete data on how effective the masks are, but there's definitely data showing that time and the amount of time that you're exposed to the virus contributes. So that's why the pods with people that you're with for a long amount of time, I think that will definitely help reduce the spread and help maintain it better. And if things do need to shut down, you're isolating less people with that can't come back, because essentially shut down the school for 2 to 5 days to assess things and think about the logistics of who's potentially infected before you can reopen. But those people in contact have to wait the 14-day incubation period. It'd be nice to have less people that have to go through that, and just try to minimize the disruption of having to shut down and have that impact. But then there's also the impact of the cohorting. How is that feasible for every school?
Well, so I could see some conversation around this around elementary school. I guess the question then, and Wagner maybe jump in, and what does that even look like in a middle school and high school with certifications and teachers and movement of classes and things like that?
Yeah, and I think we would agree to this, that every action that we are asked to implement is the antithesis of what public education should be. It's a social endeavor in all aspects of that. And not only in terms of relationships, but in terms of pedagogy and the collaboration that happens between teachers and students and other departments. And now we are really creating a quarantine within the school system. So now you were quarantined at home, but now you can come to school, but we're relegating you to only being in that classroom. Can it happen at elementary? I can make that happen elementary, absolutely, right? Because I have one teacher. I have 18 to 24 students. When we talk about where they go in terms of their specials, their music, their gym, we have to negotiate that, and we can probably work through that. But once you get into the middle and high school experience and the rotation that happens, the course selection, trying to keep a cohort, we haven't figured that out yet. Now, I'm sure if there is someone who has, I'd love to piggyback on that process, but logistics of doing that means that we'd have to compromise a significant amount of learning and coursework in order for that to actually happen.
And it might even be more critical with that older age, because some of the data is showing that it may actually be more potentially lead to higher transmission with the older children that are above the age of 10. There's been some preliminary data on that.
And there are some models where the youngest kids could go back, like pre-K to second grade or pre-K to third grade could go back. They could spread throughout buildings, and then the older kids who could continue the virtual learning as we transition back in. I've seen that model as well.
Luckily, I think there's kind of an inverse relationship. And one of the nice things about the podding and the cohorting for the little kids, in addition to working better pedagogically than for the older kids, is that's the group that it's the toughest to think about masking, right? It's hard to imagine keeping 4-year-olds and 5-year-olds masked all day. Middle school kids, we can probably keep them masked all day. They can learn new routines, and then we have a little bit more flexibility about how they're moving around the building. So.
Good point.
Yeah,
but our special needs kids, that's another consideration of masking, and that is a whole nother level of concern. Our medically fragile and special needs children.
Right. And then, one thing to also think about is, this also helps to possibly do cohort and spreading out while the weather is still amiable. But once we start getting colder and you're kind of forced to keep indoors, and that's a whole nother level of challenges that we need to start working through and thinking about and worrying about the cohorting and not being able to spread out as much. And so it's something to think about too.
As you think about like movement between classes, between hallways, eating potentially in classes, and Massachusetts guidance came out today. They talk about eating in classrooms, trying to get as many kids back. They talked about no mask pre-K through 1, potentially through 2. I start wondering about, there's been a lot of conversation about surface areas and spread of disease through high touch areas, high touch points. We have a couple scientists on the call. What is the current thinking around transmission of the virus? We know it's respiratory based, but how about surface areas when we're talking about movement of facilities?
I'm probably most concerned about bathrooms. in my opinion. But I don't know if others have thoughts. I'm just thinking that there's talks about like toilet plumes and things like that, I guess in the rest of the building, there's the airflow piece, but just sanitizing with alcohol, the virus dies pretty easily once it's on surfaces for a period of time. So I think if there's just routine cleaning, I'm not as concerned about that.
But with a 4-minute passing time, and I have 1,600 kids in high school, if I even get to 500 kids, and we're in a 3-day rotation to spread out, I still have kids touching the same surfaces potentially. Right. So what is that, like you're saying, cleaning on the tabletop, I'm assuming on a regular cleaning, I'm sure that's why they're saying hand sanitizer and constant washing of hands.
Right.
Constant
hand washing or sanitizer, yeah.
Is there a risk of surface area infection the way when, like back in March, we were talking about?
That's going to happen from surface to hand and hand to face. So you can, while it's very important to keep the high touch surfaces clean, that route is still for most fomite, unless someone's coughing directly in your face, that's going to happen via hands. So you get a lot of bang for the buck if the hand hygiene is just like fabulous, and you can keep the surfaces clean as well.
Yeah.
So Robin, you talked about preschool age children and who gets to come in. Had the opportunity to be on a call. You actually might have been on the call with the preschool providers from Head Start that came and talked about the impacts of what it looks like. During the time of the pandemic, did your facility stay open?
No.
Okay, so they were closed. So what we heard in that particular call was they had to double the staff essentially for the little ones, the 3 and 4-year-olds in particular, but had to decrease the class sizes
to 10.
To 10. So they were doubling staff, but decreasing in those programs, which are in some districts pay for programs by families for entry points. And sometimes it's special needs pre-K. Sometimes it's an integrated pre-K model, and sometimes it's a Head Start based pre-K model. So, but what we heard was the elimination of shared toys, the elimination of shared manipulatives, where students had individualized bins on desks, where districts had to really think about how they were going to, again, to Wagner's point, is the antithesis of what we talk about. We were talking to 3 and 4-year-olds about not sharing, not playing nice, because you have to be separate. Don't share, don't talk, don't step near each other, 6-foot distances. What's that going to look like in your preschool programs, Robin, in the fall?
Yeah, it is. We've had so many conversations about how this is possible. What can it look like? Preschool is such an important time. There's so much learning and development that goes on, and here we are. It could be very scary for the kids if teachers are wearing masks. It can feel, there's been this tremendous interruption in the flow of all of our lives. When you think about just what happens in the course of a school day, a school week, a school month, a school year, right? There's that rhythm that's been completely interrupted. And so, in terms of safety, there's great concern that the staff is going to be able to keep the kids separated and safe. It's, even going from 15 to 10, the rooms are, there's certain size that they have to be, but there's so many things that they're not going to be allowed to share. They're really going to have to, it's like parallel play almost, which is not what we want to promote in preschool, right? And I think the other thing about school is that it's community. School is all about creating community. And in a community like Camden City, where I work, it's really, those communities are especially important. And, it's just overwhelming to think how we can do this safely. This is all about safety. And it's safety over, we also have to look at schools we do support parents and their ability to go to work. And we have parents who have no other care system. They have no other systems of care. The structures that we have in place have been to support parents being able to work. It's absolutely true. And here we are. If I look at one of my schools, I have 4 smaller preschools. I have 360 kids. And if one of my schools has 75 kids, so that's 5 classrooms, they have nowhere to grow because it's in a small city block. They don't even have an outdoor play yard where they are. They play upstairs in the attic. So they cannot go more than 50 students in that building. That is not sustainable for their model. And the saddest part to me is they employ city residents. This is a school that has been in the city for 45 years. The director of the school actually went to preschool in the school. This is the history. So they're very concerned, can they maintain without getting fully funded for the full 75 students? And of those 50 students that they're now allowed to have, who do you choose? Who gets to have school? You know, whose work is more valuable than the next person's work? So it is, setting the safety piece aside, this whole social piece is really just so troubling. And we have to look at the full scope of it.
So to our epidemiologists and health officials, in a recent New York Times article, a group of epidemiologists were interviewed all about risk assessment. In the response, it was greater than 400 epidemiologists, mostly from a social media group. They collaborated on a letter about share the factors that go into our assessments rather than calendar time. And here's an excerpt. Although each of us will return to various activities differently because our communities are unique, how we make decisions consistently depends upon, and they list 4 things. 1, the amount of COVID-19 in each of our communities. 2, the availability of widespread testing and contact tracing. 3, accessibility of safe and effective treatments and vaccines. And 4, the risk of severe disease to ourselves and the people with whom we spend time. So when you start thinking about sort of like the risk-reward ratios and gauging decisions on reentry, what are some of those factors that are wrestling from a public health perspective within your own organization? Do you think about fall for public school, for schools?
Two words pop in my head immediately is flexibility, because everybody's kind of going to have their own situation. When you talked about that last bullet, number 4, everybody's going to have their own personal risk assessment of this, right? And of course, you know, the other things you mentioned are important too. What's happening within your community, you know, so we're thinking about, you know, whether it be my employment or schools or what have you. You know, I think, you know, you need to maintain that flexibility for what's happening and for the different scenarios that people may face even at an individual personal level. And the other one was effective communication. So I think, you know, just really effectively communicating what we know, what we don't know, what our plan is, and you know, allowing for that mechanism to make the best plan possible, and to have people have that trust and not have like an information fatigue, but just be able to make the best decision possible, to know what the options are and who to communicate to and what to do if there is a case, and all of those types of things.
So you know, jump on. I want to circle back to the communications part because I want to give the others a chance to build on what you just said, but I want to make sure we get back to communication. So Allison, any thoughts on that? On Julie's part of the article's references?
I mean, totally agree with both of those. I think again, we're going to be asking schools and school districts to put so much time this summer into planning and to having a plan for, you know, if a case pops up, what to do. But in reality, if we get to November and we have, like, people are talking about this current spike as a second wave. This is not the second wave, folks. This is like just still wave 1. Mm-hmm. If we get, you know, a big spike in November, we're going to be shutting down again. And when I think about asking schools to prioritize what to work on, one of the things to work on is a really nimble, flexible plan for back at home, back at school, back at home, back at school. I mean, forget like solving the school part, which is really important. There's just going to be more flexing than we want to even imagine. And being ready for that, I think, is so important. And how we communicate. Okay, folks, we're back. You know, we're back to red zone, or we're in, this is a blue week or a purple week, whatever it is, and helping families cope with that, you know, incredible level of disruption.
Thank you.
Very optimistic. Sorry.
No, but Denise, you've had the opportunity to work both in the pharma sector, but also in the public health, community health perspective. When you start thinking of it from like the public health angle, what kind of considerations should we be thinking with respect to with respect to everything from entranceways to temperatures, taking to shields. I mean, I know we touched on masks, and potting was sort of the preferred methodology, but I don't see my sense is from everything I've read in all the state plans, every state plan talks about masks. So I see that we're going to be investing a lot of money in masks. And on a side note, I was told today I can't get N95s without medical documentation from school authority, from school doctors. I can't just go and buy 3M masks. They're by law, there you go, the medical professionals first. So as we start thinking about providing a higher level of support to those that are in close proximity to potentially at-risk students or might be at-risk themselves, or our nurses and our medical professionals, I'm not even sure we can get our hands on some of these items. So things, when you start again, if we go back to maybe shields, is there a value in investment in shields over masks or shields with masks from an epidemiological perspective?
So the one benefit of masks is that it will, shields is that it does, cover the eyes as opposed to just the nose and the mouth region. Trying to look at it from a realistic perspective, whether or not a child or a student or high school student will keep on a shield more so than a mask. I'm not so sure about that. I do think masks are probably more of a feasible and realistic approach as far as having people be compliant, which is the most important thing. I do think masks are important. I know the temperatures, people are doing it. It's not a foolproof method, but it is something that you can do to try to catch cases early on. So it is a good idea. I think the social distancing is a big piece of it, and we need to try to incorporate that into the plan as much as possible. It is a challenge because individuals do need to we have to try to work, how do we keep the schools open as much as we can before the new cases start rolling in. I mean, as this goes on, once we hit, my anticipation is that once we start getting into the fall, we're going to start seeing more cases, and we're going to have to worry about that. And then individuals having to work and not, how do we deal with individuals having to go to work and their children being in school? So there's a lot of considerations, but I do think the masks are important. I think we should keep up with the social distancing as much as possible. I know I was reading some of the questions, and I have a child with food allergies, so I actually understand that concern as to what do we do with lunchtime and the food consideration. So that is an important piece, and another component just added on top of all of this, and the fact that now we have to worry about the fact that usually schools only have one school nurse, and now we're adding this layer of possibly adding more possibility for contamination and cross-contamination. So that's another piece to think about, is the food allergies, and then the bus. And do we have parents drop off? Do we widen the radius of people who need to drop off? Do we try to ask people to drop off their children if they don't have to go to work, if they're choosing to work from home? Do we incorporate more school buses? What's the best method of trying to get these kids to and from school? Because it's very difficult to social distance on a school bus. So that's another whole component that we need to add in after we worry about all of the in-school activity.
So, Robin, thinking about the nurse's office, thinking about the types of symptoms that come to you on a daily basis, here's just a really brief list of COVID symptoms. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. I think I had a third of these today.
That's a daily. That's a daily. I also want to bring up this whole issue of an isolation room for those people who are showing symptoms, because that's a whole nother level of preparation that we really haven't spoken about yet. And what does that mean? And New Jersey does have a school nurse, hopefully in every building. However, it could be one school nurse to 1,500 kids. It could be one school nurse to 2,000 kids if it's a high school. And that doesn't include the staff. And, across the country, 25% of schools across this country have no school nurse at all. 40% have access to a part-time school nurse. So who's doing all of this? And what does that mean? I know we're looking at New Jersey for our purposes, but there's also our neighboring states, and I think you're getting people participating from across the country. So I do want to say, you know, the power of having a certified school nurse is very important, but how much can one person be responsible for safely and not absolutely lose their mind? I mean, there's a meme going around of a school nurse standing in front of a tidal wave, because that's what this feels like right now. And certainly I know for me, school ended for me on Monday, and there is no money in my district to pay me, but I am volunteering to be on the reopening committee, because that's how concerned I am that we are not prepared. And you know, when we have these meetings, we say to each other in our meetings, can we do this? I mean, that's really the question. We know that we need to do this at some point. Does it have to be September? Can we start virtually and figure out what else we need to do? I mean, to me, that's not a fail by continuing virtual. By the time school ended, we were really kind of all getting it together, to tell you the truth. The kids got the Chromebooks, many, their hotspots were given out. I mean, we learned a lot about virtual learning. So I feel like there's this push to make us do something face-to-face in September, but is it safe? I keep going back to the safety factor. Can we begin virtually, like some states across this country are looking at doing? And then let's see, can we bring our youngest back and spread them out and do those pods, those bubbles? In fact, I saw a term, it was called quarantining, like you are, right? Have you seen that term? You know, so what you described as symptoms, that's my everyday, all day.
Right.
You know, am I going to have to isolate everyone who has any one or two of those symptoms? And then the directions are, besides the whole issue of the airflow in that room and the safety factor and having additional supplies in that room that cannot leave that room, you are not supposed to clean that room for 24 hours. You have to wait. You're supposed to wait as long as you can to clean that room. So there are just layer upon layer of complication. You know, the school nurse's office is now really a very high intensity zone for possible transmission of illness.
Right. So
I do also think a lot of this is going to bank on the prevalence in the population at that point. I mean, if we're at very low levels, obviously the risk is lower. And if we're in a position when September comes where we're back to where we were in March, then our situation is completely different. And I think our response is going to be completely different. If we're back at March, then I think virtual is probably the way we're going to have to go. But if we have really low case counts and it looks like the risk is low, then the push might be more so to start with masks and start with the social distancing and kind of go that route. So one thing we probably do need to do is plan for different scenarios and have some, what's the risk of the community at the moment when September comes? And unfortunately, that adds more work for all of us to plan for all the
No, you're
scenarios.
absolutely right. And that's what's happening. We're planning for 3 scenarios, and they're each, except for the virtual, they are each very complicated. And virtual is in its own way, but we know a little bit more about what that would look like. Unlike when we shut down, and that came to me in our district, that seemed to come out of absolutely nowhere. And it was supposed to be for 2 weeks. So here we are 4 months later, right? That's what we were told. We left March 18th. They said plan to come back March 30th. It's
so
June.
I mean, I think one thing from my perspective as an epidemiologist, until there's an antiviral or a vaccine, I don't think we should feel like this is going to go away. So I do remember when that came out in March and they were saying the 2 weeks, I thought that was optimistic based on what we knew. So I think until we have an antiviral or a vaccine, this, and even then it will still linger, but we're going to be dealing with this.
Yeah, there's not a post-COVID world at this point. We have to follow Dr. Jha and think about how we wrap our arms as a society around this virus. But
so, Dr. Hussain, when you received your guidance from Pennsylvania and the State Department of Education, are you allowed to think of different models? Have they given you permission in Pennsylvania to think in terms of a virtual option for families that are either afraid or have a medical compromised child or a medical compromised family member? Are they allowing staff members with medical fragility, either for themselves or a loved one, to opt into a different type of educational option? Or are they basically saying it's a all or nothing or in between option, but everyone's going to do the same thing?
No, actually, Pennsylvania has provided a health and safety template that requires specific explanation to the state how you're going to return. And there are particular areas where it does specifically say, what is your policy on wearing masks? And you have to articulate that in your plan. What is your policy for ensuring and supporting staff members or students with pre-existing conditions, right? How are you going to social distance on the bus? So all of these questions they ask you to put in this template that you have to decide, but they're not telling you go in one direction, right? So you made a reference with regards to masks and the availability. We're 10 weeks away from school.
Yep.
If school districts who have not made the decision on whether or not you're going to wear masks, we ordered supplies late March. We're still waiting for those. And honestly, we made a decision Monday to say, everyone gets a face shield, everyone gets the mask, go out and get as much as you can, right? Not knowing the extent in which how we're going to deliver that process. So Pennsylvania gave it a template. It provided with specific, tell us how you're going to do this. But they don't tell you, please do this or do that. They tell you, explain how you're going to do it.
Did they give you money then for your plan to buy the PPE?
No, they did not. Hopefully you'll get some money from the CARES Act in order to do that. But you know the recent article by AASA that looked at if school districts were to implement everything in the guidelines, you would need $1.8 million. And that's for a school district with less than 4,000 students.
$498 on average per child, or 1.8 million for 3,200. I have 9,500, so only about 5.4 million.
Yes. So yes, Pennsylvania is asking that you provide a variety of options for families to return to school. And it's up to you to determine with your community what's the most feasible.
Yeah, we did a community survey. We put it out Monday, and the results are coming in, but a typical response rate is about 15%. And we're over 30% right now, which is a good survey result. And right now we're trending at 56% elementary saying staying home in the fall, about 50.2% in the middle school, and about 46% at the high school level that are in my particular community are saying, if we were given a choice, we're not coming back.
Teachers or parents?
Those are parents about their children.
Wow.
So that is, I'm on trend for 4,500 to 5,000 students potentially not returning. And right now, without guidance, and we're hoping to receive that tomorrow in New Jersey, but we have no idea what that's going to say. Ultimately, we're wondering if we're going to be able to provide a flexible style models. And the other question becomes, for how long? Is the guidance going to be for fixed period of times, like we had the death by 1,000 cuts all spring, where every 2 to 4 weeks they did an extension of the order because we didn't know what we were up against. But I think we have a better sense of what we're up against. We're cranking at 40,000 cases in the United States, 42,000 cases in the United States today, hitting breaking our highest single day record. And while it's not in this region, I guess for our scientists on the call, is it fair to say that we could see a surge back in the fall? I mean, that's the fear, right? That all of a sudden, come October, the pandemic is back in our area. But with all the measures currently in place, and now the new tri-state ban that's currently been put in place by Connecticut, New York, and New Jersey, are these measures going to keep the cases low in our area, or do we risk a surge in the fall?
Well, we may see a surge just based on adherence in the community. So there could be a surge in the summer. There could be a surge in the fall. I think once we're more indoors, there's definitely more likelihood for surges. I think there's a lot of unknowns unknowns with schools, and we won't know until we try. And I think it's interesting what your survey showed, that a lot of people aren't maybe comfortable trying yet. And maybe that's because we don't have the guidance yet of how this will work and know some of these uncertainties, how they're going to play out. So I think we do need to have some flexibility, so people could have the option to do things from home, and also have that same mechanism there for people that, when they need to phase in and out if, things reopen. And I'm not sure that, we will be able to open in the fall based on a lot of the things that you mentioned. So it'd be good to be realistic and, hopefully have a path of communication of like what needs to happen before you can safely reopen.
Yeah, so I know the daycares are opening soon, or have opened, I believe, actually. And so that is, the data that we get from that will at least provide some new data as to how these measures are working. So, that's something that we'll see how those fare. I mean, it's a different age population, they have, it's slightly different risk and things like that, but it's data, and we know that data is going to be coming in, and it's something that's going to possibly help us plan for the school, even, and camps as well. I mean, that's an outdoor experience, but it's still data, and it's data that we can use in our plans.
Yeah, and we have been seeing, I think I did see something just came out today about some of the daycares. I think it was at the YMCA, and it was kind of showing that it was lower there. But, I guess it will also depend on what's happening in the community at the time. So it's, it's definitely multifactorial. But we will get more data, and we can see what's happening in the rest of the world too, because we do have a lot of schools in Europe and other parts of the world. We can see what their experiences have been and how they handle it. So, I think there's a lot to learn from that. We're, getting more information every day. I've heard very positive experiences in like the Nordic regions and some less favorable experiences in other parts. But I think they're working through the pains right now. So there might be more to see in those other regions that have been having some pain points, how they deal with it.
One thing I wanted to bring up, because we hear suggestions about this too, is if you can't keep everyone spaced and potted in the building, have kids sort of swapping in and out, alternating, which I think is a good idea to try. I would encourage schools to make those intervals as long as possible. If you're going to have, kids there half the time, better to have week on, week off than day on, day off with different groups swapping. And that just goes back to the sort of mixing an infection period and trying to kind of trim chains of transmission from home to school and back.
So you're saying week on, week off?
Better than day on, day off.
Better than day, because I've seen more day on, day off. Or
yes, you have. Well, I mean,
yeah.
Educationally, we think that works better, right? We don't want kids home for a week and then in school for a week, but epidemiologically,
it's better.
Keep them home for the whole incubation period.
And that goes back to all the different models that are out there. They have the AM PM models. They have the 3-day rotation. I mean, there are literally dozens of models that are being talked about. 2 day on, one virtual day, and then 2 days on for a different cohort. There's another model being talked about. So you have a cleaning day midweek.
It's deep cleaning in the middle, right?
But the idea of splitting your class rosters, if you can, because once again, you might have to split them in a third, depending on how high your ratios are. Not every school district has 22 in a classroom, right? There's a lot of classes out there that are sitting at 26, 28 in elementary settings. And when they can't cleanly break to 14 and fit them necessarily in the classroom still with social distance. So in that day on, or week on, week off mentality, all the other kids would theoretically be virtual when they're not in that week. And so the question becomes, that's a whole different instructional conversation for a different eve, probably for a different call. But Dr. Mercedes Wagner, as you start thinking about, fall sports are right around the corner. And there's obviously going to be a lot of pressure to try to open sports, but we're seeing the NBA struggle to reopen. We're seeing the NFL Players Association coming out and saying, don't practice. We're seeing the National Federation standards saying things like no shared equipment, no handoffs passing, no catching, no hiking, no any kind of no shared balls, no shared water bottles, no shared anything. How are you approaching your fall athletic season at this point?
Good question, timely question. On Tuesday night, I will be presenting to my board a preliminary PIAA, the safety plan, which school districts in Pennsylvania have to present to their board to determine how they are going to safely return student athletes. And ever since the governor went from red to yellow, permitting organized sports to come together, I was surprised the number of band parents, the number of football parents who sent me emails knocking on the door saying, can practice start tomorrow? I'm like, the guidelines just were released last night. So I was surprised at the hyper acceleration of wanting to do that. So Pennsylvania provided a template and some guidelines and some questions that you need to answer in accordance to CDC guidelines to return student athletes. So we put a plan together, working with other schools in my area, the other 22 schools in Montgomery County who are following suit. And really, we're following guidelines with regards to though thinking about it, the research does not support it. We're going to do temperature screening of athletes, though that's not something we're going to do in the fall. At least we don't believe that we're going to do that in the fall. We are putting in place a self-check where parents have to sign off that their child or children or I do not have or have had these symptoms. We are going to provide professional development with our coaches to monitor COVID-like symptoms, to make sure practices are conducted as safely as possible, to think about creating cohorts of students or student athletes working on particular drills, asking them to wipe down equipment. So it seems like we're rushing to do this because everyone wants to get back to normal. So we're putting a plan together. I'm sure that the boardroom is going to be filled virtually with a lot of questions about how we're going to put the plan together. But we are presenting that to the board this Tuesday night.
Now you're suggesting that there's a lot of folks advocating to allow. Are you seeing any counter arguments that, as we're seeing, or as you were starting to see cases like what's going on in University of Kansas, University of Houston, or others around that are Philadelphia and the Phillies, right? That just player athletes getting ill, student athletes getting ill, and the highest rising cohort group in New Jersey is 18 to 29-year-olds.
Yeah, we haven't seen that within my community. Now, what will happen though is that next week we are bringing together a group of community members to look at and analyze extracurricular, co-curricular activities and what does that mean in the fall. That could change in terms of their perception. But right now, I have not received a significant amount of pushback with trying to bring out-of-season athletes back onto the practice field with a long-term plan on how we bring athletes back in early August.
So, fair enough, Wagner. I mean, one of the things that we're facing in Jersey is the uncertainty of our budgetary dollars. And we are the only state that moved our tax year to July 15th. So that means the state of New Jersey has to do a gap budget between July 1 and September 30. So we're going to hear about we've already had one round of cuts, and that's being worked through the legislature now. But our next time we hear is no later than August 25th. We'll find out then if we lose additional aid. And based on the state of the economy nationally and in Jersey in particular, we have another $6 billion shortfall between October 1 and June 30th. So all school districts right now are bracing for another round of cuts. At the same time, we're trying to figure out how to purchase PPE. And as we just said, it's a huge dollar that we're potentially looking at. One of the big components of cost with PPE is not only just the actual masking or the shields, but plexiglass and temperature checks. So I'm wondering, since there's no industry standards that I can find on plexiglass and barriers, if our epidemiologists have any guidance to us about what we should be thinking about physical barriers between nurses and patients, between secretaries and adults in the main office. You get the idea. Between teachers and students in classrooms. What kind of protective barriers should we be thinking about?
I mean, I may not know the best type to get, but I've definitely seen that that's some of the models that people are using, and I would personally feel better having a barrier given the aerosol piece of it. So, I think definitely for a nurse, having whatever added protection in isolation room, if there could be barriers, if it's possible to do it within the schools, like if you could have the 6 separation and have the smaller pods, it may not be needed as much. But I think anything added you could do is just protective. So I think as far as prioritization, as Allison mentioned before, it's going to definitely be the lower numbers, the distancing. I still think masks may cover more protection than the shields, but there's more data to come for that. So I think if you can't have the mask, then definitely a shield, and plexiglass is just another barrier.
Is there any scientific evidence that shows that there's value in those shields? Like we go to the food store, right? It's a common experience that we've all had, and yet you see cashiers standing right next to each other, or the manager comes into the register change. We're going to see students and staff interacting, even though a shield will be there. It's the behavioral aspect of schools still will need to either be coached or changed. And I'm just wondering, is there an actual scientific value to some of these purchasing acquisitions that were being recommended to do? Or are they just feel-good measures?
I've seen some stuff on it as far as like with hospital use, and it's definitely an extra added layer for the eyes. It's more like to protect you, where I know they say the masks are for you to not cough on other people.
Right.
So I think it's more protective for the person that's wearing it.
Not disputing that. I guess I meant like
but
the
how
physical,
much, I don't know.
the plexiglass barriers. Yeah.
Yeah, the plexiglass barriers.
We need more. Yeah, we need more evidence. It's very intuitive, especially you think at the store. The clerks are talking to each other, but really they see a new customer every few minutes. So the barrier between them and the customer makes sense, even if the two clerks are still exposed to each other.
And then when it comes to temperature checks, I saw in the chat, many were asking that when we start thinking about the symptoms, temperature isn't necessarily the first thing that comes up.
You may not have it at all.
Yeah.
Right. So you can be, you might not have it at all. Is that what I just heard you say? So would you recommend full-scale temp checks for everyone that enters a building? And if so, is there any kind of guidance, and maybe this is to Robin, about who actually can conduct that?
So this is the big question. Is it they are recommended right now. The CDC is recommending 3 kinds of screening. One, it could be self-reporting by the parent and by the staff. If we do ask parents to do that, do we then need to provide equipment? Do we need to provide thermometers? I say yes, because I don't think I think that might be a hardship for some parents. So that's one way. Then there's the argument, well, will parents, will they be forthcoming if the child is sick? We have many sick kids come to school every day, or kids are given Tylenol or Motrin before school and their temperature stays down for a good chunk of the day. So, that's one issue. So self-reporting is one. And then there's 2 levels of actual screening at school. One would be through a barrier. There would be a plexiglass barrier. You'd stand 6 feet apart, kind of do a once over of the student and take a temp check. And one is a much more a closer check. So that would need full PPE. And would it have to only be a nurse? No, absolutely not. It could be other staff members. But is it helpful? Is it important data? Is it realistic? Yeah, somebody just raised the whole issue of confidentiality. What are we doing with this data? Are there consequences if people don't follow through and don't do the self-reporting? I've seen some districts are looking at linking staff self-reporting to actually like swipe cards to be able to get in and out of buildings. So if you don't do your Google sheet that morning, you're basically absent.
Penn announced that for students and faculty and staff this fall. There'll be an app. You'll have 2 questions, 3 questions to answer every morning, including temp, and that's what gets you swipe access to buildings.
So that in that case, I've seen that would actually limit how many people have to be screened every morning. But imagine, 500 kids, 250 kids, 100 staff. And then are we going to stagger people? Because you certainly don't want everyone cramming in the front door to get screened. Where are we doing this in multiple places? Again, should there be confidentiality? Should it be behind a screen? There's many issues around this.
Yeah, I mean, it's just an extra added measure. So obviously, if you have a fever, then you potentially have COVID. So it's important to know that, and hopefully people will check that on their own. And so maybe that could be a self-check thing that should happen and be enforced anyway at home. And then if there are people that don't have it, at home, then maybe there could be some staff to do that.
Well,
There. So then it's a lower number. It's just a thought. I don't know.
No, so that point though is really interesting about fevers with respect to in Jersey at least, and I know many states around the country have a requirement that if you have a fever, you're home until you're 24-hour fever free.
100.4.
Right. So do we have to then now assume that every person with a fever is suspected of COVID and needs a negative COVID test?
Well, now they're saying if you have a fever of 100.4, you need to be home either 48 or 72 hours fever-free with no medication.
Right. I mean, but that's true of even non-COVID. You know, we send children home sometimes if they have
for 24 hours.
Right, right.
This is set 48 or 72. But yes, are we treating everyone as if it were COVID?
That COVID has the 3-day requirement for no fever. So that's like what we're trying to do.
Well, if we're doing that, then it leads to huge questions about if we then have a teacher, because my understanding with the contact tracing is, did that individual then have contact with anyone for the 48 hours prior? And then, because then they could have been symptomatic, and our local health officials would tell us anyone that if they became symptomatic potentially within a 40-hour window, they would need to be noticed, contact traced, and then you have to then determine, were they in a physical space for more than 10 minutes with them and had their kind of close contact. But if it's a classroom teacher that's in a classroom of 10 or 12 podded, but those 10 or 12 podded most likely have siblings, they have parents, a huge percentage of teachers are married to other teachers, law enforcement, whatnot. So does everyone go into some form of quarantine, and how quickly across the school system do you go into some kind of just from a classroom to a building to a district lockdown, shutdown, and for how long?
So I guess I'm wondering, will there be communication, like a point person at the local health department that could help advise these types of questions? I guess that's where I'm thinking there needs to be a collaboration on, like, where do you draw the line? Like, what's the safest way to do this? And
that is probably fair to say local health officials need to be involved, but potentially very difficult to manage.
They are very overwhelmed, right?
Every county is different. Middlesex County has one health official, and they have some nursing support staff, and that work. And in Mercer County, we have 7 different health officials, and it's by town. So in state to state, county to county is different.
Most Philadelphia counties do not have a local health department. Most Pennsylvania counties do not have a local health department.
So this is where we're really relying on some kind of guidance from the Department of Health within our states to have a statewide standard that we can point to, because without clear health guidance from a state perspective, it's very hard. It goes right back to Wagner's earlier point that we become interpreters of medical and public health policy. That's not our role.
And we do not want schools in the contact tracing business.
Right.
Very few counties and cities have contact tracing in place.
School nurses do a lot of surveillance, but not, we certainly we will partner with our health department, but we cannot possibly add that. Although a lot of school nurses have been doing contact tracing since COVID to support the health department. But this whole issue of a fever is very important to clarify, because the CDC does say fever-free for 72 hours, but also you have to look at symptoms. When did the symptoms start? Are they asymptomatic? Right, and then there's a 10-day. So, and then we have to look at our policies of attendance. How long have we been zero tolerance for any days absent?
That's not going to be this year.
That's
not going to be this year, right? And the same.
And everybody get a flu shot. Oh my God, everybody get a flu shot.
Get a flu shot.
Well, then it also leads to questions regarding our staff, right? I mean, we have, if we're medically excluding staff, or are they using sick days? Or do they have COVID days? Like, what's this going to look like from a public employee relationship standpoint? And if someone does contract COVID, and we've had that in our district, we've had multiple members of our staff in quarantine or diagnosed during the closure, after we closed, and after a 2-week period, thank goodness. But the reality is people did contract it. We've had it in our communities. We lost a staff member to COVID. And so, you start thinking in terms of what will this actually look like? We had one staff member in a home with married to another staff member. Our understanding from the health department was the quarantine of the married spouse who was not COVID positive, their quarantine didn't start till 3 days after their spouse tested negative. They then had a 14-day quarantine. that was the local health department in the state of New Jersey's guidance. So that staff member who was home taking care of their spouse, now granted we were virtual,
Okay.
their quarantine went 14 days after there was a 3-day buffer.
Yeah. Yeah, there's the 14-day quarantine.
Buffer, but yeah.
Right. So that is, I don't know what you do. Like, I'm not sure who's coming in for $85 a day as a substitute. I'll just put it that way.
And
Well,
I'm curious
that's
what
another
the
thing.
talk
You
has
want
been.
dedicated substitutes, but just by the way, like obviously you don't want substitutes like hopping school to school, which is maybe not feasible. But Julie, what were you gonna say?
No, I was going to talk about testing too. I guess I've been curious if this has come
Oh.
up within the group, like what are the requirements for testing? So obviously there's the quarantine period, and then there's the, if you did have it, you got to wait till you're 3 days fever free and wait till 10 days pass. But they also say in there sometimes they have 2 negative tests within, greater than 24 hours. I'm curious if that's been discussed, if there's any mandates for the schools for negative testing. And we know sometimes the testing could show up positive after somebody has COVID, even if it's not an active case. So there's that potential of a person being positive for much longer than their infection.
Yep.
So that's the level of detail that we have not received yet.
Okay.
And that's really concerning. There's been some, the CDC does give guidance around these things, but in terms of our health department for school, for returning to school.
When you think about, Allison, you brought up contact tracing, and schools really, you said, shouldn't be in that business, but I have a sense that we might be asked to be in that business. If we are, and because we've already been told our school safety specialist has to be contact traced certified. So that is something that we at least have at least one staff member mandate. And I would imagine that we'll need that in at least every school and multiple staff members on it.
I think the school officials will have, and whoever's certified as a contact tracer should have a lot of helpful information about who has experienced a meaningful contact at school. What I hope is that schools aren't expected to, if a parent tests positive, to be like in the contact tracing business for, that onward case. But if a parent tests positive and the city or the local health department wants to know, can you tell us who the kids' exposures have been at school? Another reason for potting, because then it's super easy. Here's the list of 12 people. Within the school is going to have a lot of information about what the kids' exposures have been. Here's their bus pod, here's their classroom pod, here's their sports team pod, here's their after school pod.
Right, and that's usually the collaboration that does occur with school nurses when these things happen, is they do help give information as to school exposures, and then usually the health department will take that information and kind of run with it and contact those families and kind of branch out. But there is the collaboration with the school nurse in the initial report. And
absolutely.
Yeah,
that's
so that is helpful.
Yeah.
Right, exactly.
Right.
So, but usually it is the health department's task to kind of move forward with that.
Contact tracing.
Right. So I don't know that the school will be mandated or expected to take that over. I would not anticipate that. I mean, this is just my speculation at this point, but I would not anticipate that would happen. Unless they're completely, they might ask for help in certain, within the school. But I don't even know that it would be, I'm not even sure that it would be appropriate to ask the school to be calling.
Well, there's some discussion that the contact tracing is going to be more centralized, and they are training contact tracers. In fact, they're training contact tracers because the local health departments cannot possibly complete all of those contact tracings, and so they're hiring contact tracers now, and there's training that can take place. In fact, Johns Hopkins, I think almost 400,000 people have taken their contact tracing certificate course.
That'd be a great link to throw in the chat too. That's a free course that anyone can do. It takes about 6 hours. It's great.
So if I could toss it back to Wagner for a second, just to maybe one final question, and we'll give everyone an opportunity for sort of like a recap, final thoughts. And that includes you as well, Wagner. But as you start thinking about, like, PA's clearly had some other guidance documents that have been out there to help you think through planning. Just for those of us that are on the front end of, or still awaiting planning guidance, what have been some of the strategies you've used with bringing cohorts and faculty together? Obviously, I'm going to guess most of it's been virtual, but sir, who's been at the table? Who's involved in the process in your district, in your larger community? Who are you relying on to help you build the plan?
Well, we rely on our neighbors. So in Montgomery County, we have 22 superintendents. We meet twice a week to talk about the challenges that all of us are facing, how to go about that. Pennsylvania has intermediate units, so we have an IU that provides technical and logistical supports through that process. We're meeting with members of our health department periodically to get really concrete information, not just the reverbiage of the CDC statements. And I wanted to make sure that as this is evolving, I didn't want to create committees too early. So we did have a number of conversations with our parents to get a sense of what they were thinking. And we had a couple of town halls about that. So it's not until this week or next week we really start pulling together. We have a panel. We have 4 committees under curriculum and instruction is one. We have health and wellness is another. We have operations, which talks about transportation, facilities, IT, and meals. And then we have extracurricular sports. So we have 25 community members in each of those that consist of a diverse group of individuals, board members, students, custodial staff, secretarial staff, classroom teachers, specialists, collective bargaining leadership members, all who are going to meet throughout the next 3 weeks to unpack and to help put together the safety plan that the Department of Education for PA has asked us to deliver to them prior to school opening.
Thank you, Wagner. That's helpful. And we similarly have 4 committees: operations and facilities, a governance and oversight, a health and wellness committee, and a curriculum instruction committee. The co-curricular athletics is falling under one of the other committees as a subcommittee, but very similar structure to methodology. We also have scheduling, like a lot of subgroups then, like breakout committees, because there's a lot to think through. How do you safely enter? How do you safely exit? How do you transport and how do you feed? Are like some of the fundamental questions that are going to drive everything. And then layer that with obviously health, safety, which gets into nursing, counseling, trauma counseling, depression screenings, the food distribution now and through the summer. There's just so many factors at place before we even talk about the instructional aspects. And as we proceed through the summer, the Restart Ed team is going to continue a series of webinars on a multitude of topics, and I'll touch base on the next one at the end. But before we get there, I wanted to give each panelist an opportunity to just give some concluding thoughts or things for the audience. And we still have 167 folks hanging with us, almost 90 minutes in. So power to them for being there in the active chat room. But they're hanging on some of your words, and they're listening to it, and it's helping inform their thinking. So what's something that you want us to leave the audience with?
Well, I think that it's definitely important that we really take a smart approach to this to balance safety and the needs for education. So I think when the state guidance does come out, really scrutinize this again and think through all those questions, and hopefully try to look to what kind of a network you can build. I think it's going to be a long year. So I think it's good to plan ahead for September, but think about the full year. And like me personally, I haven't decided what I'm going to do in the fall yet, because we don't have all the answers yet, but we need to make a smart plan and ask all of our questions now and then see where we land based on what this virus does.
Thank you, Julie.
Sure.
Robin?
Yeah, so it's such a fluid thing, isn't it? We're always learning something new almost every day. I think that what I've really learned through this whole experience is that there's tremendous desire to collaborate across the state, across the country, really internationally. This is an issue that has brought so many people together to work to keep all of us safe. So that has been a positive. And in the state of New Jersey, something amazing happened today for school nurses. A bill passed through the Senate Education Committee to finally have a state school nurse consultant at the Department of Education. It's going to the state, to the Senate, and hopefully a twin bill in the Assembly will pass, because we have not had representation at the state level. And it was because of COVID and the opportunity to sit on a state committee that we were able to express this issue. So we're really encouraged by the, amplifying the importance of having a certified school nurse in every building, and utilizing the expertise, because we are the health experts in a building, and we certainly do surveillance, and we certainly do counseling and work with families. And so I think if nothing else has come out of this awful time, the value of having a school nurse certainly has been shown.
Thank you, Robin. Denise?
But I think there's a lot of work tasks to the schools in this process. And I think one thing we've seen is that there's going to be a lot of collaboration needed, and a lot is being put on the school. That being said, I think, from the EPI perspective, trying to look at the data that we have, the best data, the newest data, and make the recommendations to try to give the schools guidance, but not over, not to try to have them put, like you were saying about the finances, not trying to over mandate things, try to have as many protective measures in place without kind of going overboard and then expecting the schools to be able to pay for all of these things. So I think really we're going to have to use the data and the collaboration to try to make the best plan with what we have, and know that this every week, every day, we're learning new things about this virus. So anything that we propose now might change come August, and we're going to have to just be really flexible with that.
Thank you. Wagner?
Yeah, I'll piggyback in terms of flexibility. The reality is for Pennsylvania, because of the trends going downwards in terms of positive cases, it's not a matter of when we're going to open, it's how we're going to open. And I think we're going to have to, we're flying this plane as we're building it. But for me, I think besides the physical safety, medical safety of our staff, one of my biggest concerns, and we need to think about, is the traumatic experience that we are putting children under with this return. So we talk about trauma-informed pedagogy, and think about the last 5 months where kids have not been with each other, have not been in school, and the experiences that they faced. Then they're going to be hurled back into a system that is extremely foreign, that is the antithesis of what they're accustomed to doing, and fearful about whether or not, if they're going to get sick, their teacher's going to get sick. And I think we need to look at September, October, November, December as opportunities for healing and supporting children and staff, and that the curriculum will have to take a back seat to staff and students' social emotional needs.
Thank you, Ax. Allison, back to you.
I don't think I can say anything better than what everyone else just did, especially Wagner. I mean, I think the goal for the fall, I think we should manage expectations, that the goal for the fall is safety for our staff and some safe social coming back together for kids. And if, our test scores drop or every kid doesn't get into Harvard next year, that's okay. The enemy here is the virus. And it sucks, and it's not going away anytime soon. But I think with a lot of flexibility and a lot of patience and a lot of humility, and keeping our kids kind of centered, and the safety of our staff and faculty centered, we need to do the best we can. And it's just going to take everybody being like, flexibility, I think, is the new superpower. Maybe creativity, number two, to sort of get through what's not going to look like normal. Next year's not going to look like normal, but I think we can do something for the kids that's different from being home all spring.
I greatly appreciate the panelists spending their time and sharing their expertise with all of us. On behalf of the RestartED team that graciously asked me to be here tonight, I thank you for the opportunity. to learn from this panel. I would also just say that the idea of trauma and SEL and trauma-informed care and trauma-informed pedagogy actually becomes our next topic. So we are going to step away on the 2nd for an extended 4th of July weekend. But on July 9th, that evening, the RestartED team will bring forward the topic of understanding trauma manifestations in school-age children. So we'll have an expert panel to talk that evening about what the fall will look like and to talk through trauma from the perspective of school-age children, but I'm sure they'll also talk about how that impacts the adults in the building. So our thanks and appreciation to all those that joined this evening. And again, to the panelists, thank you. Great pleasure. And if you're able to join us in the debrief afterwards, by all means, please do. Thanks, everyone.
Thanks so much.
Be well.
Thank you.
Stay safe, everybody,
Yeah, be safe.
and sane.